Okay, so welcome everyone. We're glad you're here. We're going to get started, and I'd like to quickly review a few items. We'd like to remind everyone of our commitment to maintaining a safe and accountable space. If you experience issues and need assistance, please reach out to me by sending me a direct message found at the top right corner of the event. To walk you through the tools in the session, I'd like to draw your attention to the vertical bar featuring several icons on the right side of your screen. If your event feed is open, it's going to be hiding your vertical bar, so please close your event feed by clicking the X in the upper right corner of the event feed box. The event feed is like the chat box for the entire event rather than just this session. Once you've closed your event feed, you'll be able to see a vertical bar with several icons. You'll see speech squares, that's the chat box for this session, or the Q&A icon. And please use this to ask the presenters questions. You may also vote for questions if you're very interested in hearing the answer to a question. Next, there's an icon of people indicating the participants in the session. Lastly, you'll see two papers stacked one on top of the other, and these are all the resources from the presenter, including the slide deck for this session. To enable us to keep up with questions, we ask that you please use only the Q&A icon to share your questions with the speakers, and feel free to vote for the questions. Again, it's the third icon from the top with the Q&A on the vertical bar. If at any time during the session you need to step away, take a break, debrief, or decompress, please feel free to do so. Our wellness room is open. You may enter the wellness room by clicking on the wellness room button on the top left side of the event navigation bar. A member of our team will meet you there. Okay, so now it's my pleasure to introduce our speakers for the session, Ricardo Canelo and Jessica Gonzalez. Ricardo Canelo is an MPH and is the project coordinator for the Mental Health Technology Transfer Center, or MHTTC, Network Coordinating Office, NCO. The MHTTC NCO is part of the Center for Dissemination and Implementation in the Department of Psychiatry and Behavioral Sciences at Stanford University School of Medicine. Ricardo coordinates the work of 10 centers that provides training and technical assistance to the mental health workforce to increase the use of evidence-based mental health prevention, treatment, and recovery support services across the United States. Jessica Gonzalez is the Associate Project Director for the Mental Health Technology Transfer Center Network Coordinating Office and coordinates the MHTTC School Mental Health Initiative. She previously worked in the community as a social worker, providing mental health services in school and in outpatient clinic settings to children and adolescents of diverse backgrounds. Thank you both for being here, and now the stage is yours.
Thank you so much for that introduction, Kendall. Can you hear me okay, everybody? Awesome. Well, hello and welcome, and we're happy that you are here today to discuss behavioral threat assessment in schools with us. The next slide is a quick disclaimer that the opinions that are expressed in today's session are mine and Ricardo's as individual speakers and do not reflect the official position of our funder, the Substance Abuse and Mental Health Services Administration. On our next slide, we also just quickly want to recognize that we strive to use affirming, respectful, and recovery-oriented language in all of our activities, and these are our values that we will hold throughout today's session. A brief agenda of what we'll discuss today. We'll start with a brief overview of school violence and behavioral threat assessment, also known as BTA. And then we'll dive into findings from a roundtable that we conducted to examine considerations for BTA use in schools. We'll then go into some findings from a scoping review that we conducted on the measurement of outcomes in BTA. And then we'll close with overall recommendations for improving behavioral threat assessment implementation. We also hope that we'll have some time for questions. I also just want to emphasize before we officially get started that Ricardo and I are here to share this information with you all. We don't have specific expertise in BTA in schools, as in we don't have experience being a part of a BTA team in schools, but we are presenting here today from a research perspective, and we hope that you will keep this in mind. We will try to answer as many questions from our perspective during the Q&A session, and we've also included some resources towards the end of our presentation to help you in your BTA implementation efforts, if that is a part of your role. And so before we get into the main topic for today's presentation, I really just want to take a moment and share a little bit about the MHTTC network, especially for those of you in the audience who maybe have not worked with our network previously. We are a network of 11 centers that provide free resources, training, and technical assistance to increase the use of evidence-based and promising practices in mental health promotion, treatment, and recovery. 10 of our centers are regionally based, so they are spread out across the country, as you can see here on our beautiful, colorful map. There's also a coordinating office, and that's where Ricardo and I come from, and we help coordinate the entire network. We hope that you'll visit our website, mhttcnetwork.org, to learn more about the center that serves your region and to access all of the free trainings and resources that your regional center provides. By visiting our website, you can also subscribe to our newsletter to stay up to date on learning opportunities that we provide outside of this conference session that we're leading today. I also just want to call out our school mental health initiative. We have funding that allows us to provide training and technical assistance to the general mental health workforce, but we also have specific funding to provide training to the school mental health workforce. We refer to this specific work as our school mental health initiative. It is through this initiative that we provide training, technical assistance, and resources, all free of cost, to address key school mental health issues, including school violence, suicide prevention, intervention, and recovery, the well-being of school mental health providers and educators, and more. Aside from virtual and face-to-face trainings and workshops, we also lead virtual learning communities and learning collaboratives. We develop online courses and fact sheets, podcasts, many other tools to help the school mental health workforce implement school mental health evidence-based practices. And again, all of our training, TA activities, and resources are available free of cost to you. So we encourage you to visit our website and access our resources on our website. We have a training and events calendar that outlines all of the upcoming trainings and events that are coming up, led by our regional centers and available free of cost to you. We also have a product and resources catalog, and there we archive all of our resources and products that we develop, again, free of cost. I hope that this mini orientation to the MHTTC network has been helpful for those of you in the audience who may not have worked with us before. But now I'll pass it over to my colleague, Ricardo, who will get us oriented to the main topic of our session today, which is school violence and behavioral threat assessment. Ricky?
Thanks, Jessica. So good morning, good afternoon, wherever you are. And let's talk about school violence. So students are exposed to various forms of school violence. Bullying is one of the most common forms, with about 1 in 5 students experiencing bullying. But students are exposed to other forms as well, such as involvement in physical altercations, being threatened or harmed with a weapon. And with respect to gun violence, the Center for Homeland Defense and Security reports that just over 2,000 school shooting incidents have taken place on school property between January 1970 and June of 2022. And that translates to an average of about 40 shootings a year. And when taken together, all of these different forms of school violence can negatively impact student mental health. So school violence is associated with concerns like anxiety, depression, aggression, and post-traumatic stress. And there are also risks for decreased school performance and social withdrawal. And so all of these things have led youth exposure to violence to be considered as an adverse childhood experience. So with this in mind, how do schools address school violence? I won't go into too much detail on this slide, but generally, you can group these strategies into 3 categories. So there are strategies without an evidence base, strategies with mixed evidence, and then there are those that have an evidence base. And some strategies are listed below as an example, but given the content of today's presentation, you might be wondering, where does BTA fall? So with that, let's talk about BTA a little bit and the evidence base behind it. So BTA was developed by the Secret Service in the 1990s to identify, evaluate, and manage threats of people of people who have the ability and desire to carry out targeted attacks. And so over the past 20 years, BTA has been adapted from law enforcement to school settings. And one predominant model of these guidelines is the Comprehensive School Threat Assessment Guidelines, otherwise known as the CSTAG. And this was developed by the University of Virginia in 2001. And so we'll go over on the next slide, basically how this framework is designed to be employed in schools. And so the CSTAG is a 5-step process that's meant to help identify, evaluate, and manage threats in 3 different categories. So there's transient, which is the least severe, substantive, which is of medium severity, and very serious substantive, which is the most severe. So step 1 of this process is to learn more about the threat. So this is gathering observations from potential victims, the student who made the threat, and other witnesses. And this is really meant to help understand the circumstances of the threat and evaluate the student's intentions as to whether or not they wanted to actually harm someone. Step 2 is to resolve the threat as transient. So here you might get the student to apologize and just retract the threat overall and indicate that there was no intent to harm. And other services could also be provided if necessary. Step 3 is to respond to substantive threats. So this would include taking precautionary measures to protect possible victims. And these measures could include giving warnings to possible victims and their caregivers, identifying conflict resolution methods, and also disciplining the student making the threat if necessary. Step 4 is to respond to the most severe threats, very serious substantive. So this would include mental health screening or a law enforcement investigation, developing a safety plan to address the student's needs while also mitigating risks towards others, and assigning discipline until these actions are completed. And then finally, there's step 5, which is to implement a safety plan and maintain contact with the student. And the plan can also be revised as needed so that way you can monitor its success. And so thinking about BTA, you might be wondering, how adopted is it in schools? So about 2 of 5 US schools have a BTA team. And we also examined state policies on BTA from the National Association of State Boards of Education. And what we found was 41 states and territories either mandate, encourage, or address BTA through law or non-codified policies. But not all BTA policies are the same. So as an example, you can see Pennsylvania and Ohio there, they both require BTA. But Pennsylvania's BTA mandate explicitly calls out charter schools as an inclusion for that mandate. And then for Ohio, it's only mandated to be used in secondary schools, so middle and high schools, not elementary schools. And this really goes to show that while BTA is widely adopted, the manner in which it's implemented can vary greatly. Okay. And so let's think about the strengths and the limitations for BTA in schools. So there are a couple of strengths associated with BTA. So for example, some studies have found that secondary schools that use BTA may experience improvements in school climate, such as increased feelings of school safety. And BTA has also been associated with reductions in severe disciplinary actions, such as suspensions and expulsions, as well as increases in non-disciplinary outcomes, such as counseling. That said, BTA has also been associated with a number of negatives, such as disparities in both referrals and outcomes for students with disabilities and underrepresented racial and ethnic groups. As an example, Black and Native students are 2 and 9 times more likely, respectively, to be referred for BTA, and for students receiving special education services, they're 4 times more likely to be referred. There's also an absence of cultural competence in BTA research. So O'Malley and colleagues back in 2019 looked at different topics related to cultural competence to see how well covered they were in the BTA literature and found that not many topics were well covered at all, if any. And then there's also concerns raised by a number of stakeholders about the appropriateness of law enforcement involvement in schools, particularly how it can impact a student's right to due process and whether it exacerbates a school-to-prison pipeline for students of color. So why are we focusing on BTA? So we were asked by our funder in 2023 to develop a report on BTA and its intersection with student mental health. And so what we did was we conducted a roundtable on BTA, a scoping review on BTA outcome measurement, And we publish these findings and more in a BTA report. So today, we're going to talk a bit more about the findings from each of these different deliverables. And so with that, I'll pass it back to Jessica so she could talk about a roundtable that we did.
Awesome. Thank you, Ricky. So before I dive into the findings that rose to the top from this roundtable that we conducted, we want to explain why we conducted the roundtable discussion on behavioral threat assessment in the first place, aside from being asked by our funder to explore this topic of behavioral threat assessment in schools further and how behavioral threat assessment leads or can lead to prevention of school violence. We chose to conduct this roundtable discussion because we wanted to learn more about BTA and its purpose, of course, its use in schools and best practices of behavioral threat assessment. But we also wanted to discuss considerations for behavioral threat assessment use in schools. As Ricky mentioned previously, there are definitely concerns to consider when using BTA in schools. That includes the fit and the appropriateness of using BTA in schools, the referral outcome disparities that exist for special education and Black, Indigenous, and students of color, and the role of law enforcement in schools, privacy of student information, and cultural competence are also concerns. There's also a lot of research surrounding the different models of BTA, but not exactly how they're being implemented in schools, and so that was definitely a great interest of ours. We also wanted to understand the different perspectives of BTA across multiple disciplines, and the relationship between BTA and student mental health, which really has not been well examined in the existing literature. So we invited 17 subject matter experts from diverse backgrounds and diverse expertise in school mental health, expertise across school mental health, behavioral threat assessment, expertise in law, in policy, and education and advocacy. So we had, for example, school mental health providers at the table. We had lawyers, we had law enforcement officials, we had educators, and we also had advocates for students and school mental health in general. And so we facilitated discussions with these 17 roundtable participants over the span of about 4 hours and across a variety of topics. The topics that were included are here on this slide. That included BTA in mental health, the use of BTA in schools, youth and family engagement in behavioral threat assessment, legal and privacy considerations, cultural considerations, and BTA implementation, training, and evaluation. So we held this 4-hour roundtable with these 17 subject matter experts across these various topics. And then what we did after that, we recorded those conversations and we reviewed the information that was compiled during the roundtable. And in reviewing that information and analyzing that data that we compiled, we identified several key themes that arose during the discussions. And today, that's what I will share with you. I will walk us through each of those important themes that came up in those roundtable conversations. The foundations of BTA were most frequently discussed in the roundtable, particularly the context in which BTA is being implemented in schools. There were 3 main contexts that were identified: the socio-political context, the conceptual context, and the historical context. So I'll walk through each one of these today. For the socio-political context, what came up in the discussions in the roundtable was inadequate funding and resources available for successful BTA implementation. Then also the potential disregard of several educational and privacy laws, such as the Individuals with Disabilities Education Act, or FERPA, Family Educational Rights and Privacy Act, that when overlooked may result in not only school removal for students without due process, but also grant BTA team members, including law enforcement, endless access to student records. So those were the main concerns that arose there within that context. For the conceptual context, roundtable participants brought forth concerns around how the BTA framework is being translated from its initial use in the Secret Service to now using that BTA framework in schools, and how are schools equipped or not to adopt BTA to children and youth. Roundtable participants were conceptually opposed to BTA those who were opposed to BTA kind of expressed its similarity in militarizing a mental health process. Roundtable participants also pointed out that our interpretations are obviously influenced by what we know, and so we need to ask what biases exist in what a threat is. And that is what the quote that we share on the screen here from one of our roundtable participants is getting at, specifically regarding Muslim children who are often automatically identified as threats. And finally, the historical context that arose during these conversations in our roundtable. Some discussion in the roundtable was around historically underrepresented communities, valid mistrust and trauma in school systems, and how that leads to some of this general skepticism of BTA implementation. Ricky, I'm seeing on the screen here that the slides have been taken down. I'm not sure if you changed anything there. Can you hear me, Ricky? I think you're muted.
Jessica, do you by chance have the slides as well?
I'm actually not able to pull them up right now.
Okay. Yeah, I think it may be your internet connection, Ricky. Okay, let's here, let's just give Ricky a second here. Jessica, if there's something that you want to cover that doesn't require the slides for now.
Yeah, I can definitely keep going.
Okay, thanks. Yep.
Yeah, so I'm hoping that people are able to follow along by opening the slides up from that resource tab on the platform. I think that Ricky's texting me and letting me know, Kendall, that he's not able to unmute himself for some reason. The AirMeet platform isn't working for him. He's going to try and rejoin, and I will just try to pick up from where I left off, if that's okay. Can you still hear me, Kendall?
Yes, we can hear you, and we'll try to get the slides another way here in just a second.
Okay, awesome. Well, I just kind of finished talking through those 3 different contexts in which we were discussing BTA foundations with the participants of our roundtable. And I wanted to go into the next key theme that came up in our conversations with the participants. And that was around the implementation considerations for BTA. And so when we talk about implementation considerations, we refer to them with respect to team development. So how is a behavioral threat assessment team developed? How do we engage with youth and family and community around the use of BTA in schools and the actual process and how it works? And how do we continue to keep that transparency when there is a moment in time where there has been a threat identified and we do engage in this behavioral threat assessment process? How do we remain transparent with the youth and the family and the community about that? And then there were also stigma and equity concerns that came up when we talk about implementation of BTA in schools. Going into a little bit of more detail, there was a very nuanced conversation regarding the need for multidisciplinary BTA teams and who should constitute them. So there were some concerns raised about student privacy. For example, if law enforcement are involved in these BTA teams, there's a fear, right, that they'll have superfluous access to student records. And we ask ourselves, to what extent might that impact the student's future, kind of having this on their record? And particularly, we're interested in the impact that it might have on BIPOC students and their future, especially since we've noticed in what we've learned through the roundtable and through some of the other research that we've conducted recently, that BIPOC students tend to be disproportionately targeted at times with this BTA process. And if not managed correctly, this can definitely result in over-policing. Roundtable participants also noted some of the challenges that they noticed in BTA teams, such as readiness and awareness of implicit bias and how that plays a role in executing a process that the school might have in place in the use of these behavioral threat assessment teams. Given the disproportionate impact on historically underrepresented communities, the roundtable participants also discussed the importance of engaging communities by creating solutions with them rather than for them. So there was discussion around the importance of transparency in BTA cases and throughout the BTA process, also recognizing how there are barriers that may affect family and community engagement, such as socioeconomic factors. And like I mentioned earlier, stigma and equity issues were also notable and related to the concern of disproportionate threat referrals among BIPOC and special education students. So there were concerns about misinterpretation of needs, increased law enforcement contact, and the importance of having BTA work in tandem with other school mental health supports. The next theme here that I wanted to dive into that really did, kind of rise to the top here were the perceptions of the effectiveness and utilization of BTA in schools. So the roundtable participants that we had, that we invited to this roundtable, again, they came from various disciplines, diverse backgrounds. Many of them have had experience being a part of a behavioral threat assessment team in a school. And so it was important for us to kind of learn from them about their experiences and what they thought about the effectiveness and the utilization of these teams in schools. And so how did the roundtable participants perceive what BTA effectiveness looked like? This was influenced by their interpretation of some of the existing literature that exists, also influenced by their own lived experience, like I just mentioned. And so some overall viewed BTA as effective due to the reported positive outcomes that are outlined in past research, but there were also several others who were generally skeptical of the validity of that BTA research. Overall, perceptions of BTA use in schools was more negative than positive, specifically negatively perceived for youth with disabilities and Black, Latinx, and Indigenous youth. And so I talked a little bit about lived experiences with BTA in schools. And so we had those roundtable participants who spoke directly about their firsthand on the ground experiences. And so some of the positive discussion that surrounded how proper BTA implementation allows student mental health needs to be identified earlier and thus grants access to appropriate services earlier before a threat is actually executed. That was something that participants brought up as something that they found positive in the use of this BTA process. They also felt that it would reduce disciplinary action that might remove students from their regular educational environment, so less suspensions, less expulsions. These positive outcomes were often attributed to the fact that there was a multidisciplinary team approach and the engagement of the community, which, like I mentioned previously, is very important. Some of the negative firsthand experiences were related to the racial, ethnic, and disability biases and inequities that do exist when executing this process, from what we've learned from past research. On the next slide, I have the final roundtable theme that I wanted to go into today, and that's BTA recommendations. Ultimately, we had a portion of our roundtable discussion with the roundtable participants focused on if we have these concerns and we have this skepticism about BTA use, while also having some of these positive experiences that these roundtable participants discussed, what are some recommendations that they, have to improve multiple aspects of BTA use in schools? And so the recommendations that were given to us were mainly focused around the implementation of BTA, including how to improve BTA team development having better training around BTA and implicit bias, again, engaging the community and addressing some of the disparities that we previously discussed directly related to those BIPOC student communities. Suggestions also included improving the foundational aspects of BTA laws and frameworks. The quote that we have highlighted here on the slide specifically mentions, the importance of not only defining terms like threat, safety, or success, but also having guardrails about their use. One example that came up around having guardrails was defining which behaviors should warrant BTA referral, such as violent threats. Another example focused on reshaping policies to specifically outline when BTA should be used and who specifically should be included on a BTA team. And then with regards to data and information sharing, roundtable participants noted the paradox between maintaining transparency but also protecting student privacy. One potential solution that was offered was to be transparent with some of the existing research data, making that information more accessible to youth, families, and communities to engage them in the BTA process and what the intentions of BTA are and how it's implemented in schools, and reduce that mistrust while still protecting student information and overall privacy during the actual BTA process. So I just discussed a lot of main ideas that came from that roundtable, and I apologize for the interruption caused by the slides coming down. I just want to take a quick minute here to recap for everyone what we just discussed and what we just went over. Overall, the most frequently discussed topics were related to the context in which BTA is implemented and implementation considerations for BTA. Overall, we know that schools may not always follow best practices for BTA, given its widespread adoption and the variety of policies mandating it. So future research should really better examine how schools are implementing BTA. And while participants had mixed perceptions about BTA research findings, they described experiences with BTA implementation more positively when adhering to best practices. Although those with firsthand experience implementing BTA have largely seen positive outcomes, there were also negative firsthand experiences that were related to those racial, ethnic, and disability biases and inequities. Recommendations for improving multiple aspects of BTA in schools overall focused on policy gaps and information dissemination. So overall, I think key takeaway here is that school violence impacts us all. And so when implementing school violence prevention programs such as BTA, it is important for us to take into consideration the perspectives of all stakeholders, like we did through this roundtable. And that includes, students and families, communities in which BTA is implemented, school staff, school mental health providers, policy experts and advocates. Perspectives from these stakeholders should be considered. And that leads me to a couple of limitations in the roundtable discussion that we conducted. The roundtable included a small sample, right? We have 17 participants. It's a small sample of school staff, researchers, advocates, and lawyers. And so the findings are not representative of all relevant BTA stakeholders. Although advocates with close community ties were represented, students and families were not directly included in this discussion, which means that their interests or views weren't directly represented. And that is one key takeaway for us. Through that process, we were learning from these 17 subject matter experts, just the great importance of having students and families at the table to have these discussions, because this is something that directly affects them and their children in schools. So having, their interests and views represented is very important. Another limitation was that in a group setting, right, this roundtable was 17 people plus our Stanford team coming together in a shared space to have this conversation. We're in a group setting and there's no confidentiality or anonymity, which might have discouraged some people with different opinions from sharing them or speaking overall. We recognize that different data collection methodologies, like conducting one-on-one interviews, may have yielded different results. So remember, this was just one of 3 activities that we led in our exploration of behavioral threat assessment in schools. I'll go ahead and pass it over to Ricky now. Hopefully, Ricky, I hope your audio is working properly. And I'll have you share the findings from our scoping review that we conducted to really zone in and help us understand more about the outcomes of BTA and how those are measured.
Thank you, Jessica, and my apologies, everyone. I just could not unmute. I couldn't stop the share to kind of figure that out, so I appreciate your patience as we figured that out technically. So with that said, let's dive into the scoping review. So Jessica briefly described about how the definition of success is a consideration for BTA. So in that vein, we wanted to learn more about what outcomes exactly are measured. So we proceeded with a scoping review with this main research question. What is the current approach to evaluating BTA outcomes in US K-12 schools? So with a librarian, we identified sources of published and unpublished literature, and we also searched for articles with a main focus on BTA outcome evaluation based in US K-12 schools and published between April 1999 and March 2023. And that first date really is to reflect the dates of the Columbine High School shooting, which really served as a catalyst for a lot of the adaptations made for BTA from law enforcement to school settings. So our initial search was pretty vast. We had over 4,000 documents to look through, but we were able to remove quite a few duplicates, which led us to review the titles and the abstracts of just over 3,000 documents. And we identified 271 that met our criteria for further full text review. And from there, of that 271, we identified 28 that met our criteria for data analysis. And so from these 28 documents, we analyzed data around what outcomes were measured, what methods were used, where data were collected, and recommendations for future research. And so with that, let's talk about some of these results. So most documents studied BTA in an elementary school setting, used quantitative methods, examined data from one point in time, and studied a certain set of BTA guidelines, usually the CSTAG. And it's also worth noting that most studies were authored by CSTAG developers. And while there were studies conducted across 7 states, as you see on this map here, most studies did take place in one state, and that was Virginia. So most documents also examine data from students and schools alike, with a handful looking at other sources, including educators, school mental health staff, and district staff. But looking at this graph here, there's a bit of a trend that you might notice. So here we see that suspensions are by far measured most frequently. Just over 60% of the articles that we did find examined suspensions. But if you look at the top 5 there, you'll notice that many of them really do focus on disciplinary outcomes. So this would include legal/law enforcement actions, such as arrests and court charges. There was also changes in placement, so basically placing the student in an alternative setting. And also there were expulsions, removing the student from school altogether. There were some non-disciplinary outcomes that were measured as well. As you can see, mental health and special education services were measured just over 30% of all of the included studies. And this really focused on service provision. But you'll notice in the bottom 5 there that there are more non-disciplinary outcomes that are studied less frequently, such as bullying frequency in the school environment, parent conferences and notification, as well as perceptions of safety for both staff and students alike. So looking at our recommendations, the vast majority of documents that we identified did make recommendations for future research. And so we looked through these 73 recommendations and broke them up into 5 prominent themes that we're going to talk through one by one. So approaches to assessing threat and implementing BTA was the most prominent theme in the recommendations. Some researchers recommended studies to address a number of different topics, and this included the logistics behind team decisions related to BTA, the readiness of school administrators to manage crises, and fidelity to BTA frameworks, which, while not the goal of this review, was also not thoroughly examined by articles in this review. Other recommendations also included getting perceptions from and engaging with other stakeholders. So as Jessica mentioned, really talking to people that are affected, so students, families, staff, and also evaluating how each school using BTA procedures conducts the process. A quarter of the recommendations that we observed reflected a need for different research methodologies. So one important recommendation was to compare BTA with other school violence prevention strategies to see if there are differences in student outcomes or school safety. And then there were other recommendations focused on strengthening the research base, such as using large-scale randomized control trials to provide evidence on BTA's impact in reducing suspensions as well as ensuring equity across different student groups. So for example, students of color and students receiving special education services. There's also another recommendation to improve the generalizability of findings. And an example of this would be looking at BTA in a variety of different states, as well as studying other BTA models. Okay. So responses to threats was another prominent theme that came up, and recommendations in this theme really emphasized the need for non-disciplinary supportive approaches among BTA teams. But other recommendations really focused on different aspects of the BTA approach. Examples of this included studying differences between proactive and reactive responses, as well as responses to completed versus averted threats. And one thing that specifically came up was to compare BTA with zero tolerance approaches, the latter of which is not evidence-based and may actually worsen school climate. So really seeing if it's better than just zero tolerance alone. And then long-term effects was another theme that came up about as often as responses to threat. And this reflected the fact that only one study in our scoping review looked at longer-term outcomes related to BTA, and that outcome was graduation rates. But in addition to academic achievement, other outcomes should also be looked at further, such as the avoidance of further discipline, conflict resolution, other factors as well that might impact school climate. And these outcomes should be explored in culturally responsive contexts to see if there are disparities across student groups. Which actually brings me to our last theme here, which is disparities. And while it was the least prominent, it's clear based on what we've covered today that it is important to address. And so it's important to investigate whether BTA can reduce existing disparities in those exclusionary disciplinary practices, such as suspension and expulsion. Also understand why why certain mechanisms behind BTA may not lead to disparities in certain outcomes. And also look at how increased participation among historically underrepresented populations can impact the creation of positive, safe, and equitable school cultures. So looking a bit about what we found again related to the scoping review. So a lot of these documents were authored by or collected data from one state, and this really does limit the applicability of these findings across different settings. So it's really important to be able to look at different states, have different groups look at BTA and really understand if they find outcomes are the same or different as it pertains to BTA. And also it's important to notice that disciplinary outcomes were measured more often than non-disciplinary outcomes. I think we can all agree that it is important to reduce exclusionary discipline, but at the same time, there are benefits to supportive non-disciplinary approaches that we have to examine in BTA literature. And also, there was little examination of mental health outcomes as a whole, so not just focusing on provision, but the actual impact of BTA on student mental health. So looking at symptomatology, looking at mental health status, and more. And there was also little examination of the association between fidelity to BTA frameworks and BTA outcomes as well. As I mentioned, I think a handful of studies kind of looked at BTA fidelity, but they only looked at it in a very limited scope. So we want to expand that. So there were a couple limitations related to the scoping review, which are pretty common for reviews like this. We may have missed some documents published outside of this time frame, including within the last year or so. And we did limit our search to certain databases. So we may have missed articles that were published in different databases of both published and unpublished literature. So to conclude the scoping review portion, again, the generalizability in BTA research is very limited. And so further study is really needed to kind of expand this. So again, different research groups looking at BTA, looking at it across different states, and also using opportunities for future research, such as looking at BTA outcomes over time, looking at those things that might impact school climate, also looking at mental health status and BTA's impact on that, And again, as we just talked about, looking at fidelity and how it might impact BTA outcomes. And so with that, I'll turn to the last leg of the stool here of the 3 deliverables, which was this report, Behavioral Threat Assessment in Schools, Evidence, Fit, and Appropriateness. And so this report was really designed to describe school violence in BTA, report on the current state of BTA implementation and its effectiveness, describe considerations for the fit and appropriateness of using BTA in schools, and also offer recommendations for different stakeholders in addressing BTA use. And we didn't just limit this to schools. We also included other stakeholders such as researchers, policymakers, funders, communities, and more. And you'll see that on a later slide. But with that, one more thing. This report does combine what we've already talked about with the scoping review and the BTA roundtable. It also includes a brief literature review on BTA and school violence prevention because we really wanted to understand what the evidence base was. And so with that, let's talk a bit about the evidence base. So there are positives and negatives associated with BTA, right? We've mentioned this before. So some studies in Virginia schools have found that less bullying was reported by students in schools using BTA. And also some studies found that there were improved school climates in Virginia middle and high schools using the CSTAG. And this included increased feelings of school safety, willingness to help, to seek for help when needed, and also less worry about a shooting taking place on a school campus. And in Virginia schools using the CSTAG, the schools were less likely to use long-term and out-of-school suspensions, alternate placements, as well as law enforcement actions. That said, there were also some negatives. So there were some mixed results on the prevalence of aggressive violence. So while there were fewer bullying infractions found in one study in Virginia schools, the same study found no changes in student assaults and student threats. And another study also found that there were no differences in the acts of aggressive violence. And then, as we've talked about before, again, there are disparities in BTA referral and discipline. So talking about students receiving special education first, 2 studies found that these students in Virginia schools using the CSTAG were more likely to have their threat classified as serious. They were 4 times more likely to be referred for BTA, as I previously mentioned, and they also faced an increased likelihood of being suspended. For students of color, they were also more likely to be referred for BTA. So as we talked about, a study in Colorado found that Black and Native students twice and 9 times more likely, respectively, to be referred for BTA. And other districts have also found that Black students are overrepresented in their BTA cases. And a couple of examples is the Dallas Independent School District in 2021 and the Albuquerque Public Schools in 2019. That said, the evidence is a bit more mixed with regard to discipline for students of color. So one study of Virginia schools did find that there were no disparities in severe disciplinary outcomes. But that said, other studies in Virginia schools have found that Hispanic students are at least 3.5 times more likely to have law enforcement action taken against them compared to white students. And there were also short-term and long-term suspension disparities for Black children in Virginia secondary schools using the CSTAG. So talking about some different considerations for fit and appropriateness, I mentioned this when we looked at the map, but essentially there's a wide variety in BTA implementation across the country. And part of this is because there's a lack of explicit guidelines for use. So taking Virginia as an example, while they mandate BTA, there's no specific guideline that's mandated for use. So for example, you could use the CSTAG, or you could also use the guidelines developed by Virginia's Department of Criminal Justice Services. And on top of that, the National Threat Assessment Center, run by Secret Service, qualifies their own threat assessment guidelines by saying that they're minimal and that they should be tailored to individual district and school needs. And this really goes to show how these needs can influence the adaptation of best practices. Talking a bit about mental health, it's important to note that it's not common for serious mental illness to lead one to commit acts of violence. There are predictors such as substance use, adverse childhood experiences, and other environmental issues, such as living in an area of high crime. But mental health status alone is not a predictor of violence. And in fact, mental health status should be addressed during BTA, and it should not be influencing the severity of disciplinary and non-disciplinary outcomes. It's also important to note that a best practice for BTA is the usage of multidisciplinary teams, but school mental health staff shortages and the lack of requirements to participate in BTA make this more difficult to use in practice. And so these two things combined can impact outcomes and may eventually impact referral to mental health interventions. And then finally, trauma-informed practices are needed. So it's important to, for example, identify and avoid student triggers, engage in relationship building, and promote consistency as a supplement to BTA, as there's no focus currently in the predominant BTA model. O'Malley and colleagues have suggested ways to do this, though, such as training staff and students in trauma-informed care and avoiding stigmatizing language when evaluating a threat. And other frameworks that do incorporate trauma-informed approaches can be used here to supplement BTA. And so here I'm going to go one by one real quickly, because I know we have 10 minutes left, about the different recommendations that we have. So for schools, it's really important to address school violence using a range of effective programs. I think one person said it best: BTA is not a cure-all for school violence. It's best used when supplemented with other violence prevention programs. And to that extent, we also recommend that policymakers and funders allocate more funding for health promotion and violence prevention. And so by addressing school violence through a promotion or a prevention lens, you reduce the need for BTA at a later point when violence is about to occur or has occurred. For schools, youth, families, communities, etc., it's important to include meaningful engagement and participation in the adoption and implementation of school violence prevention programs. So again, we've discussed how the involvement of these communities is essential before implementing a program. It goes back to this premise of nothing for us without us. It's also important for schools and researchers alike to address these different biases in BTA. So again, talking about the disparities that we've noticed in referral and also exclusionary discipline for both students of color and students receiving special education services. It's also important for schools, researchers, and policymakers to clarify BTA policies and align them with best practices. And so by delineating these practices in policy, it's much easier to follow these practices. An example is with New Jersey and how they clearly outlined who should be a part of a BTA team. And they've actually made funding available so that way schools can hire school mental health staff to among other things, work on a BTA team. And then finally, for researchers, funders, youth, etc., it's really important to conduct research to fill gaps in knowledge about BTA, including mental health related outcomes. So not just focusing on provision, but really focusing on what is the actual impact of BTA on student mental health status and other long-term outcomes. So what are some of the key takeaways from all that we've talked about today? So the intent of BTA is to standardize how threats are assessed and prevent school violence. And while this is true, we also have to recognize that there are inequities in this process, particularly for students of color and for students receiving special education services. Protecting schools should not come at the cost of vulnerable student populations. It's also important to note that BTA can have promising outcomes, as we've seen with the reduction of exclusionary discipline, but more research is needed. Again, looking at mental health status, looking at different outcomes over time to see what is the long-term effect of BTA on students. And I think this is the most important point here. School violence cannot be solved by schools alone. And so it's a multifaceted problem that requires multifaceted solutions. And with stakeholders working together across disciplines, we can work together to protect our nation's youth from school violence. And so with that, you can access our complete BTA report on our website. We've linked to it in the resources tab. You can access the QR code here. Like we've mentioned, our resources are free of cost. That's the same case with this report. And then you can also, let's see here, if it wants to show. There we go. So like Jessica mentioned, we want to reemphasize that while we don't have expertise in BTA personally, we have presented these materials today from a research perspective. And so we have included these resources here today to see if that might help you in your actual BTA implementation efforts. I don't know that we'll have time for questions, but that said, if you do have questions, you can always contact us at networkoffice@mhttcnetwork.org. You can also visit our website, and you can also follow us on social media on X, Facebook, and LinkedIn at MHTTC Network. So with that, Kendall, do we have time for questions?
We do have time for questions. We have about 6 minutes left. So I'm going to read the questions out loud here, and then I'll have you two take it away and answer them. So we're going to start by a question from John. Has there been any research done on the climate and overall socioeconomic of the population where there have been completed acts of violence? In other words, are there comparisons of communities where these acts have taken place that correlate?
Okay, I see. That's a great question. I think that there is a body of research called, and I know that the Secret Service has also put out reports of different um, acts of targeted violence. I think it's a yearly report that they put out that they kind of talk a bit more about targeted attacks and just the profile behind, I think, where the shootings do take place, as well as the shooters, I believe. That might be a good resource to look into that further. But I'm not personally aware of any trends related to that, though.
Okay, thank you. The next question is from Willow. Is the recommendation that the definition of threat be determined at the school level, the district level, the state level, etc.?
That's a great question. So it's a two-pronged approach to that, right? So you want to make it clear, I think, at a policy standpoint, to make it clear so that way it's easier for schools to implement. But at the end of the day, I think it really is up to the school, maybe the district, to kind of really define how it is that they classify threat, like what behaviors are threatening and what measures you can take to be able to address those acts accordingly.
Okay, great. Then we also have a question from Marissa. How do you best help a student who you may feel is heading toward becoming a serious threat, but parents won't engage or accept help?
That's a good question. And I think part of that goes back to addressing it from a promotion prevention lens, right? So if there are other school-wide programs that really focus on school violence outside of threat assessment, that are being used among all students, like kind of like a tier 1 type support, I think that would be important to use. And I think also it's important to, I know they've had difficulties engaging with the students' parents, but I think it's really trying to look at those attitudes and try to really understand the rationale behind them and try to figure out ways to address that accordingly, and also understand if it's a wider issue in the community. To possibly address that further in their implementation of violence prevention programs.
Okay, great. We have a question from John. He said, I heard the numbers that had been compiled that spoke to the disproportionate identification of certain groups of individuals, but how do they correlate with the actual numbers of insider threats that have taken place in schools over the last 10 to 15 years?
Would you mind repeating that question? I just want to make sure I understand it.
Yep. So he was referencing, I think he said, I heard the numbers that had been compiled that spoke to the disproportionate identification of certain groups of individuals, but how do they correlate with the actual numbers of insider threats that have taken place in schools over the last 10 to 15 years?
Oh, okay. So okay. I think I understand the question. Yeah, that's a really good question. I know that in the BTA literature, there are some demographics that kind of look at BTA cases overall. I don't know if there is literature around who's the second part of that question, which was, I think, can you repeat that part? I'm sorry.
Yeah, it's the number of insider threats that have taken place.
Yeah, so I don't know if there are necessarily numbers on the number of insider threats that have taken place, but I know that there are demographics in the BTA literature for the number of BTA cases. But I'm not so sure about insider threats.
Okay, cool. We'll take one more here, which is, do you know if any, have there been any interview of actors that have perpetuated and survived their violent attacks?
We did not include those interviews, but I do think that that is a relevant group of stakeholders to include. And I know that there are groups out there that do kind of focus on this. I know the Parkland families have their own group, I believe, an advocacy group of sorts that do focus on that. So that would be a good stakeholder to, get that feedback from. I also know that there was a question too around the bullying stats, and I know that those statistics came from the CDC Youth Risk Behavior Survey. If you go into our report, we have the citation for that, and I think that might provide some more information as to how bullying was defined and whatnot.
Great. Well, I just want to say thank you so much to Ricardo and Jessica. Thank you for sharing your time and your experience and your expertise. Thank you all to those who attended and for bearing with us during some technical issues that we were able to figure out. And if you could, to all the attendees, please complete the summit survey on the reception page at the end of the day. We'd really appreciate your feedback. And you must complete the survey to request continuing education hours as a reminder as well. So I want to say thank you again and have a great day.